Hi, I'm Bill. I'm the owner of Telemedicine Florida. This presentation is a simple, cost-effective method for implementing clinical telemedicine with e-health records. First, I'd like to talk about the Florida statutes on telemedicine. Physicians and physician's assistants shall not provide treatment recommendations, including using a prescription via electronic or other means, unless the following elements have been met: a documented patient evaluation, including history and physical examination to establish the diagnosis for which the legend drug is prescribed, discussions between the physician and the physician's assistant and the patient regarding treatment options and the risk and the benefits of treatment, maintenance of contemporaneous medical records meeting the requirements of the Rule 64B 9.003 FAC. Well, here's how it works. When a patient arrives, they usually fill out their medical history sheet and sign some document waivers, and one of those should be their agreement that it's okay to use telemedicine to visually consult with the doctor. Also, they will have a agreement in there to allow them to utilize electronic health records. Some clinics have documents emailed in advance and downloaded from the website, so the patient has them completed when they arrive. Also, an online form can be developed based on your practice so that the information can be directly entered into the patient record keeping system. This also has special security implication, but is easily and accomplished in the cloud. Well, telemedicine is designed to improve the efficiency of the medical staff and enable physicians to see more patients in less time. The medical staff still has to do the workup, but if the doctor doesn't have to physically touch the patient, then telemedicine can allow more timely visits to his or her patients. Follow-up visits and consultations are perfect use for the telemedicine. The e-health records are the patient's medical records are scanned into the secure SharePoint server in the cloud using the HTTPS 128-bit encryption to comply with HIPAA laws. It makes it easy for the doctor to pull up the latest information in the chart, and he can pull it up from anywhere. Actually, if he can do it from his office, his home, and maybe sitting on the beach in Aruba, but it's easy for him to look at any of the records, review, and consult with other physicians. After the patient has the workup done, the doctor is notified and visually sees the patient via secure connections. In these pictures, the patient sees and converses with the doctor. If you look at A at the remote clinic and A at the doctor's office, that's what the patient is looking at. Patient and A, she is looking at the doctor, and the doctor sees the patient in his screen. And then on the B, while the doctor is interviewing the patient, the nurse on the left is making notes about the consultation. All these documents, information is then ends up and scanned into the cloud servers in the patient file. Most of our doctors have a second monitor in their office. That way they can view the charts on a separate monitor while they're talking to the patients. So in this case, we see the labs on the left and the patient history on the right, and they can scan through these and look if they have an EKG in there, X-rays, anything really that's stored in the chart can be stored digitally in the cloud on the in the patient's medical history file. The beauty of the telemedicine system is that physicians can collaborate from anywhere in the world over the cloud network. Secure audio and video is available with a click of the mouse. Medical charts can be viewed by all participants or only a selected few. X-rays, EKGs, etc. can all be viewed and collaborated. And it doesn't matter where the other doctor physician is. He could be in his office, he could be at the hospital, he could be at home. All he has to do is have an internet connection and be in the secure group that is set up by the system administrator, and the physician, the nurses, the doctors all can collaborate at the same time. We have an abundance of other cost-effective applications, including patient scheduling. That's one of our most popular items, is that most doctors' office have schedules, electronic schedules, but they can't get it to from everywhere. So if the doctor's at home, the nurses at another clinic, then for them to get their schedules, they have to carry something around with them. Well, with the cloud technology, you can view your schedules online and have it transmitted directly to your iPhone or smartphone, and you can see your schedules. And when you go to schedule patients, you can look at any doctor side by side and create a scheduling from anywhere in the world. Implementing a telemedicine practice. First, you got to purchase the necessary hardware, and most of the hardware necessary for a telemedicine practice is a simple camera. I use a Microsoft 6000X camera. It costs approximately $75 to $100 for each of your computer terminals. You have to have, of course, a good PC. If you're using a multi-monitor, you have to have a good graphics card in that monitor. They're not very expensive, maybe $150, and then an additional monitor that allows you to view the charts while you're actually seeing the patient at the same time. You need to sign the Microsoft online agreement. The online agreement is basically, it runs about $15 per terminal or per user. In most cases, it's a minimum of 5 users. If you buy this before the end of 2009, there's a 30% discount from Microsoft. You got to review the physician's regulation for telemedicine. Each physician may have a special caveat in the statutes for telemedicine, so you have to review that to make sure that's implemented. And once we understand all the different rules and regulations that apply to that specific physician's practice, we implement a 10-step procedure. So make sure that you're HIPAA compliant. We have the American Health Telemedicine Association standards, and we will be sure that your clinic has met those standards, so there won't be any legal or HIPAA violations. Each patient needs to agree to allow for the use of telemedicine and electronic medical record consultation. It's just an agreement when they first come in that they agree that to allow you to use it, and that covers you in most all circumstances. The next thing we do is we make sure that we test all the camera equipment, scanners, inter-office communications, so that there is no glitches in the hardware, software, internet communications. Then we complete your training. We go through a complete training with you. We give you online training classes that you can actually log in anytime and be trained and actually utilize the camera systems and everything online. And then we come in and do the Q&A and make sure that you have a complete understanding. Physicians, we usually train separately because of their schedules, so we make sure that they understand exactly what they need. Whether they need to understand scanning or not, I don't think so, but yeah, I think it's important that they understand the whole procedure. Once the training is completed, the main thing that we do is we rehearse the procedure. Very simple. We practice the video conferencing, make sure that the scanning and everything is done smoothly before you actually implement this procedure. It's very simple, but it's a different procedure in the office because of the nature of the video conferencing equipment and electronics. And then you go live, and then it works very well. This is state-of-the-art stuff, so it's not easily understood, but believe me, it's easy to implement. You don't need any IT people around to help with this project. You don't need servers, and you just need a PC and a connection. So it's easy, it's safe, it's secure, and it's very inexpensive, and it will make your office much more productive. So give me a call if you have any questions, or email me at bill@telemedicineFLorida.com. I'll be glad to answer them. And if you're in the Tampa, Clearwater, Sarasota area, I'll be more than happy to come by and visit with you. Thanks for taking the time to listen to me. We will have another slide video and on with questions and answers. Just go to the website and click on that. Thanks again. See you later.